Parents, if your kid has dealt with ear infections, you know this horrible routine. They're fussy, they're upset, they're pulling at their face and their ear, and every single time they're congested, they have a little bit of a cold, you're so worried it'll turn into something worse. Ear infections are one of the things that are so common in kids, but I would argue are not normal at all. 80 to 90% of kids have had an ear infection by age 3, but I really don't think that number should be that high. And this video is to explain why is it taking place so frequently, and more importantly, what can you do about it in a more natural, drug-free way? So many of the parents that we've talked to, they've used the garlic mullein oil and they've done some of the other holistic options, and those things are good and they're helpful, but you still are missing a part of it if your kid is on that path. So let's talk about what's going on. Like I said, this is so common for kids, and it leads to lifelong challenges because usually if you're dealing with recurring ear infections, you're taking antibiotic after antibiotic, and it leads to all sorts of gut and other neuroimmune challenges in the future. And this is a topic that has always been one that I get extra excited and extra passionate about. And I think there's a lot of reasons for that. We've seen so many stories of kids do amazingly well, getting off of that fast track to tubes, getting back on track with their health through chiropractic. But our very first patient ever was a little boy at 1.5 who was on that journey, who had ear infection after ear infection after ear infection, was on the next step for getting tubes, and his mom was like, oh my gosh, what can we do? I don't want to do that. I hate giving him these medications, but I don't know where else to turn. That dude started getting adjusted. He's never had an ear infection since, and now we're 7+ years later. He's still crushing it, getting adjusted every week and doing amazingly well. That is the story that every kid deserves, but it's not happening because parents do not have and do not know this information. So why are these taking place? I'm going to give you a little anatomy lesson here. The eustachian tubes are not the only piece of this story that we need to be concerned with, right? If you've been told, maybe you are looking for that why explanation, the answer that's usually given is that those eustachian tubes, right, the tunnel that goes from the outer ear into that drainage piece of it, in kids, that is more horizontal and less tilted down, right? It's more straight across and not as tilted as it is in adults. Because of that, that fluid and that flow is said to not have gone as smoothly. It gets jammed up more easily, and that leads to the infections and everything else. But what I think we need to understand is that eustachian tube here, right, that tunnel going from the ear down, that is not just a drain pipe that you need to tilt down and then all of a sudden everything is fine again, right? This is more like a collapsed muscular tube, right? Think of it like a tube of toothpaste. That drainage is taking place through this motion called peristalsis. It's the same way that food moves through your gut or your intestinal systems. It's this wave-like contraction that pushes fluid down through that tube. So when it's not draining, it's not that you need to tilt it down. It's not that their tubes just happen to be more flat than adults. It's that there's something that is creating this tension that is not allowing it to drain, not allowing that fluid to move. So let's think about what's going on there, right? If we have this eustachian tube right up here, there is a lot of other parts of our neuroanatomy that are related there as well. This plumbing system, ears right here, upper cervical spine, occiput C1, C2, millimeters away from that. That proximity means that any extra stress in our upper cervical region is going to create a lot of extra tension on that head and neck, which means that pulling, especially this tensor veli palatini muscle, that pulling in those structures means that that fluid is tight and stuck now instead of able to move and drain. So that's the first big issue with these kids, is these plumbing issues. Maybe you're wondering, well, what the heck, how would my baby, how would my toddler be dealing with this jammed up upper cervical spine? The answer for that is more often than not the birth process. We see kids over and over and over again when you have at least, forceps, vacuum extraction, C-section delivery, major stress in that upper neck. But honestly, even most of the vaginal births these days, there's pulling at that baby's head and neck. They're stuck in the birth canal. Maybe there was a lot of pushing. You were on Pitocin and there's these extra forceful contractions. There's something going on in birth besides just mom and baby calling the shots, and that creates a lot of tension in that upper region. So that's when we're talking through families with ear infections, that's usually what we see is the pattern, that there's some sort of extra birth tension that has set that upper neck on this path of the draining issues and everything else. What's interesting is that the same regions here that we're talking about that's going to affect that plumbing and that drainage, it's also controlling other things. And that's where the other piece of why kids are dealing with this comes in. It addresses that neuroimmune regulation, right? This very top of your neck, there's a nerve called the vagus nerve that runs all of the calming sides of your nervous system, your digestion, your immune system, your wellness, your kids' milestones, their relaxation, all of those things are going to get affected if that same upper stress is existing. So now we have this neurostress creating a fight or flight response in your kid. And that's another reason why we see the kids dealing with ear infections so frequently had nursing or latching problems. Maybe they had a preference in their head rotation. They favored looking to one side more than the other. Sometimes that even leads to a flattening in the head, in the back of the head, that leads to a helmet. These kids are often colicky, not sleeping well, refluxy, maybe constipated, because it's all a part of this same process, right? These aren't separate challenges they're dealing with. It's all the same underlying cause. And now we have this jammed up plumbing system, a neurological system that has a weakened immune system, which means higher inflammation. And then the cherry on top is the toxic, not so great wellness lifestyle that we live in. And this varies for families, right? Some do an amazing job of having a clean environment, but there's way too much dairy and sugar and just artificial colors and sweeteners and flavors and just toxic things that our kids shouldn't be exposed with. Some of them can handle it better than others, but if we've got this dysregulated nervous system, you put that in on top of it, and now we're gonna have an even worse immune system with more and more challenges. So what do we do about that, right? The typical treatment is antibiotics. And that is going to temporarily give the kid a relief in some of those symptoms, right? Because it's maybe gonna lower the inflammation, it's gonna lower that pressure. But that is such a missing piece of the story here, right? One, that's usually not even the best course of action, because when it's a viral response, that's not what we need to do. And even the bacterial infections, the recommendation early on is wait and see, let their body's immune system develop and kick it. But so frequently that doesn't happen, and now we're setting them up for other problems, because that antibiotic is gonna mess up their gut health, that's gonna mess up their microbiome, and so now our immune system and our neurology is even more in that state of stress, and we're setting that kid up for lifelong challenges, plus a weakened immune system. So instead of going that route, let's address the cause, right? Let's address that plumbing, let's address that neuroregulation, and get to the bottom of it. One way that we help do that is our scans, right? Those neurological assessments, here's one of them of a kid that would absolutely be dealing with ear infections. When we see that upper stress on our scans, right, this color in the top of the neck, that tells us that we have a much higher chance of that dysregulated poor plumbing nervous system taking place. Specifically this pattern here, that back and forth, right, C1, C2 on the right, that tells us this counter torquing or this upper cervical spine is really locked in with some extra stress. So that is really what we need to do, is let's look at how that is functioning. Let's address the cause neurologically so that that plumbing can do what it's designed to do, so that we can get drainage happening again, and so that then that neurological response can get back to a more balanced state, out of stress, out of fight or flight. Because if we don't, it's not just the ear infections that kid's gonna be dealing with. It is going to be the next step and the next step and the next step. Because just like we saw, that the ear infections are often preceded by a colicky, fussy baby that's has torticollis or plagiocephaly or reflux or all these other challenges. Usually, once we get past the ear infections, whether that's getting past that with tubes or eventually they just grow out of it, and go into the next version of those challenges, which is asthma and allergies, tonsils and adenoids inflamed, and even into more of that neurosensory world, where now we got a kid in school and they have anxiety, they have ADHD, they're dealing with sensory processing challenges, and it's this whole journey that unless you address the why, unless you get rid of that underlying stress, it's just gonna keep showing up as something different down the road. So guys, whether or not you're in the early part of that journey or you've got through it and you're dealing with now the worst challenges down the road, let's address the why. That's the biggest message I have for you. Don't just focus on the symptomatic piece of it. Parents, let's get back to the cause. Let's address that part of the story so that our kids can get lasting relief. If you have any other questions or thoughts on your family, on your kid, do not hesitate to reach out. Send us a message. We're here to help. And if you want to get your kids scanned, contact the team, right? We will answer any questions you have on that, and we'll get your kids set up so that we can figure out what's going on and put together a game plan to help them be at their best. Can't wait to meet you in the office soon and help your family thrive.